Hello, my name is Dr. Michael Simmons. I wanted to share with you some important things about treating sleep disordered breathing. Is this you? Is this you and your spouse trying to share a good night's rest? You may find you can't do that because if one of you snores, both of you are going to get poor sleep. Now there's lots of ways to treat snoring, and sleep disordered breathing includes more than just snoring. It includes that social problem of mild snoring, much more serious snoring, and even sleep apnea. And sleep apnea has some pretty serious medical consequences. Consequences such as increased blood pressure, cardiovascular risk of arrhythmias, heart attacks, issues with diabetes, becoming overweight, depression, impotence, and many other things. So we don't want to just ignore sleep apnea. Now, what is sleep apnea and what is snoring? Well, snoring is a sound that you make when you're trying to breathe at night. But sleep apnea may make no sound. You may have so much difficulty breathing that it's like this. Not any air is traveling down the windpipe. And it's not until you hear this kind of noise that somebody is actually breathing. It's very frightening to watch your bed partner have that much difficulty breathing during your sleep. And you often want to wake them up and say, breathe, breathe. Anyway, there's lots of different approaches to treating somebody that has sleep disordered breathing. And one of the most often chosen options is using continuous positive airway pressure, called CPAP for short. Using CPAP, air is blown into the nose and down the airway to keep the airway open. And here's some examples of some masks that can be worn to enable you to breathe. Why don't you put that on for me? And we're going to show everybody what it looks like. This is one type of device, and this tube is connected through a long tube to a breathing machine that pumps air. And there's maybe a 6-foot hose, and sometimes the air is heated and sometimes humidified, and the air pressure can be at different levels depending on how much your airway closes. So this is one type of mask. When you take that one off, we have other types of masks that people like to use. Here's another example. Put that one on for me. And you can see again this hose can be connected. And there are people that are experts, respiratory therapists, at arranging which is the best mask with the best kind of fit for you, and that's who you would connect to make it happen. Let me take that one off. We even have softer, spongy, gel-type masks that cover the nose. We'll try this one on now, and you can see how this one looks. And you may say, wow, there's so many different ones, and I'm only showing you a few of them. And this strap here can be tightened. Do you want to pull that one forwards? Very good. And it hooks on right like this. Okay? And again, this is connected to a hose. Now some people, why don't we take that one off, can't breathe through their nose. That's a problem because if you can't breathe through your nose, blowing air into one of these nose masks won't help you. And for those people, we have a bigger mask which covers the nose and the mouth. Why don't you try that on? Wonderful. Okay. So these things are all designed to enable you to breathe at night using a breathing machine. Sorry. And yeah, you can see there's a little bit of trickiness in fitting these things until you're used to doing it. And I'm going to show you a little picture back here. This was a little cartoon I made of somebody looking like they're wearing a CPAP machine, and as you can see, it's not exactly an attractive way to treat snoring and sleep apnea, but it is very effective. What I want to show you also is another approach. Another approach uses mouthpieces. Here's an example of a mouthpiece. The reason that you can't breathe at night is because when you have sleep apnea or heavy snoring, your airway closes. In order to open your airway, you can bring your jaw forwards like this, and by protruding, you get your tongue out of your throat. Using mouthpieces that fit on the top and the bottom jaw and are adjustable to allow the jaw to come further forwards can open your airway where you don't need the breathing machine. Here's an example of an adjustable mouthpiece that does it. Simply fits in the mouth. No hoses, no other things that attach you, and a little less claustrophobic for people that have trouble with the breathing machine. There are other designs. Some are colored in a pretty color. There's other ones that use a kind of a screw and a hook kind of approach where you turn a little gauge and it brings a hook forwards. And there are even more sophisticated mouthpieces. The beauty of the mouthpiece versus the CPAP machine is that most people, when given both choices, prefer the mouthpiece. However, both can work very well, and it's up to you to follow up with your doctor, your physician, or your dentist, a specially trained dentist in treating snoring and sleep apnea, to come up with the best approach for you. We look forward to helping you. Please follow us, and if you can, email us and we'll give you answers to any of your questions. Thank you and have a good evening.